The good doctor. Uh-oh. I gotta get my phone if I'm gonna take a text or question. 507-838-5233 is the number if you'd like to text a question to Dr. Erik Stroemer. He's been with us before here from the Orthopedic and Fracture Clinic. You work in Northfield and Faribault, right?
Correct, and we also see patients in Farmington and Lakeville.
Yeah. Wow. So you're a busy guy.
Yeah.
Are the surgeries all done here?
Here in Faribault or at Northfield, those are the two hospitals we cover.
Okay. So if you go to the Farmington or Lakeville clinics and you have to have surgery, it's either in Northfield or Faribault.
Correct. Correct. Exactly correct.
So how many surgeries would you do in a week, average?
Do about 4 to 6 a day, and you have 2 surgery days, so anywhere from 10 to 12 surgeries a week. Sometimes if they're bigger surgeries, if we have a bunch of hip and knee and shoulder replacements, we'll do less. If it's littler things like carpal tunnels, we'll do more.
These have come a long way, haven't they?
Oh, joint replacements?
Yeah.
Yeah. Oh, it's even from when I finished med school in the late 90s till today, there's been huge advances in both the implants and just how we do the surgeries themselves.
How do you keep updated on all that stuff?
Good question. Going to courses and reading journals has been kind of the time-tested way to keep up with all that. Now, with the internet now, I can read multiple journals with articles that interest me a lot more than having to try to go to the library and find them. So the internet has helped a lot to keep up with stuff. Also, some national specialists will put out talks that you can just watch on your phone. If I'm at the hospital and I have an hour before something's going to start, I could watch a whole update on any type of medical topic I want. So technology has helped, I think, both the patient and the doctor stay on top of things.
Yeah. Well, I don't know. Sometimes maybe the patients think they're too informed, right?
Well,
when you come
I don't
to
know.
the office.
Well, you can never be too informed, but I think there's a lot of confusing medical information, a lot of words people may not understand, and that's where I try to help, is try to explain it to everybody. So I don't want them to think we're doing something magic. I want them to be real informed. But yeah, sometimes people will come in with a lot of information that maybe doesn't pertain to their condition.
And if an old person like me walks into your office and says, I want a new knee, you don't just automatically put a new knee in.
No, we're not like McDonald's where you just order something and we give it back to you. Now, if you came in and we took an x-ray and it was bone on bone and you tell me you've tried physical therapy and braces and shots and medicines and you've tried all these things and nothing's working, then that's a conversation to have. But no, I can't remember a time when someone just came in and said, I want a new knee. It's usually a longer process than that.
I mean, it's hurting.
Correct.
Nobody likes pain, right?
Correct, yeah. And we like to talk about, what's your expectations. If you still want to climb mountains, that's a different thing than if you just want to go play a little golf. So, we talk about, every patient's a little different, so we want to talk about your specific case and what's going to be the best for you to get you back to what you want to do.
Yeah. Well, the number one thing I think I don't remember if it was you or one of the other doctors told me to do to relieve pressure on your joints is to lose your weight.
Correct. Every pound you carry extra is 4 pounds of pressure through your hips and knees and ankles. So every time you lose a pound, that's less pressure on your joints, and the cartilage in your joints is it doesn't grow back. So it's like the tread on the tire. Once the tread on the tire is all the way gone, we still do not have a good way to grow it all back. So you sometimes have to get a joint replaced. But if you want to try to stay away from that, yeah, the later you are, the better.
Yep, that's probably coming though, the cartilage, but we'll talk about that a
Yep.
little bit later on. Well, we were going to talk shoulders and pitch counts and all that, but we might as well go to I'm asking for texted questions. I should go right to those, don't you think, Dr. Stroemer?
Sure.
Dr. Erik Stroemer, do you know much about surgery or anything?
Well, I'm not a foot specialist. We do a lot of take care of a lot of foot conditions at our clinic. We do some foot surgery. I don't do as much foot surgery. Some of my partners will do more foot surgery than me.
It says here, how successful is plantar fascia surgery and is it recommended?
Okay. Plantar fasciitis is a condition where you have pain in your heel. There's a tight band of tissue from your heel to the ball of the foot that becomes chronically inflamed. It happens to a lot of people. I must see someone. I'm in clinic 3 days a week, and I must see someone at least once every clinic with plantar fasciitis. It's that common. The recommended treatments are not surgery. The recommended treatments are time, number one. There's
Which is not easy to
there's
do, right?
Correct. There's a classic article called a tincture of time, meaning most of the studies will show that whatever any healthcare provider does to you, within 2 years your plantar fasciitis will go away. Well, no one in America wants to wait 2 years for anything to go away.
That's pretty painful too.
Correct. So the mainstays of treatment are a couple different stretching programs to stretch the area, ice massage where you roll your foot around on a frozen bottle of water, a frozen tennis ball to try to massage it with ice. There's a resting night brace that you wear on your foot to help stretch it while you sleep. Physical therapy treatments are helpful, and we do a lot of injections for this problem. Where I trained at the University of Minnesota, the foot and ankle specialist there did not recommend plantar fascia surgery. They felt that it could lead to other problems in your foot in the future that may be even a worse problem. So I myself have never done an actual surgery for plantar fasciitis because that's just the way I was trained, that we should do everything else and it usually will help.
So in other words, you've never even been required to do one because things have worked that you've used.
Correct. Yeah. Now, that's not to say I could have had a couple patients that never got better and went somewhere else. I don't know. I just think we try to be as conservative as possible because there's an old saying that there's not a surgery that can't make you worse. So we try to be as conservative as possible, and they always have it be the last thing to do.
Yeah, I was just going to say I like that approach.
Yeah. I mean, there's I find myself talking people out of it, surgery for a while. We were talking earlier off the air about joint replacements. It's become so common. Everybody's getting joint replaced. It seems like, everyone's doing great, but about 10% of the time something complicated happens, and unless it's the last resort, that it's a shame if you were to come out of something worse. So we like to, try everything else first before surgery.
Oh, you wanted to touch on shoulders today, right? And I know I cover a lot of volleyball. I used to do some gopher volleyball, and they're putting a lot of strain on those shoulders.
Correct. Yeah, overhead athletes are always having shoulder issues. So throwing athletes, volleyball, basketball, things overhead, pitching obviously, and swimming. Those lot of shoulder issues. A majority of the time, in younger people, it's just something gets inflamed. There becomes one muscle that's not doing its job and the other ones are overdoing it, and a majority of the time shoulder issues in younger people can be helped or cured with basic physical therapy treatments and modifying the way you do that activity. Older people, that tends to get in more of a chronic nature. The two most common things we see in shoulders in people over the age of 50 are chronic rotator cuff either tears or inflammation, or the shoulder wearing out, arthritis. Those are the two most common things. Still, a majority of the time, both those problems we can keep you going without surgery. A good physical therapy program, a good home stretching program, some medications, changing a little bit of your technique of whatever sport you want to do, and occasionally some injections. We can keep people going quite a long time.
Yeah, tennis would be another one.
Oh yeah, tennis is big. A lot of tennis players around here, and now that again, besides the serve, sometimes you can get away. You can just modify a little bit of your stroke and see if you can not have as much shoulder pain.
So again, Dr. Erik Stroemer is with us from the Orthopedic and Fracture Clinic. If you have a question, 507-838-5233 is the phone number. On that note, I spoke with Craig Anderson. He's the head baseball coach in Pine Island. He's on a committee with a high school league that's currently looking at having a pitch count implemented for high school baseball players. And after watching a game last night, it kind of hammers home the fact that it's needed. I saw a young man throw 175 pitches in a game last night, and I know I told you about it.
Yeah, that seems a little excessively high. There's been a big push the last 10 years, at least from the Orthopedic Association, that we're seeing a lot more kids' shoulder and elbow injuries from throwing. And actually, the famous orthopedic surgeon James Andrews from down in Alabama, who treats a lot of pro athletes, was having to do Tommy John surgery on high school kids weekly. And he, obviously he's a successful surgeon, but he doesn't want to have to do surgery on high school elbows. So he's been real active in pushing a campaign to limit pitches, and the American Academy of Orthopedic Surgery has a whole guideline that they recommend as far as pitch counts for different age groups, as well as how many days rest you should have in between games.
Yeah, they used to have I know even when I played, they had limited the number of innings you could pitch, but you can throw a lot of pitches in an inning.
Correct, yeah. Yeah, just ask the Twins pitchers. Oh, no, I'm just kidding.
Well, especially the last couple of days, they had that 16-inning affair.
Yeah, there's been some long games. It was a tough Sunday there. The Wild lose a heartbreaker and the Twins lose a heartbreaker. That was a tough Sunday.
But those are professional athletes.
Correct, yeah.
We're talking high schoolers here.
Yeah, and correct. And the one of the bigger issues is high school kids, they still may not be fully grown, so they still have open growth plates in their shoulders and elbows. They can actually physically change the shape of those growth plates because they're still softer with too much throwing. So it's a big deal, and it can lead to some big issues down the road. Even if you don't make it to the major leagues, you may have issues just with the regular job. So I think it's worthwhile looking at those having pitch count limits, I think.
I would guess you'd have the same stance on throwing a curveball or something, right?
Yeah, I think there's recommendations. I'd have to look it up where the American Academy of Orthopedic Surgeons don't even recommend throwing a curveball before the age of 16. I'd have to look that up, but I think they don't recommend you throw any curveballs until a certain age. So yeah, pitch counts. I think that I'd be on board for that.
When I was in high school, our JV coach, because he was a promising young star in the Twins were scouting him, he had a rule where you couldn't throw a curveball until you were 16 years old.
And that was back when you were?
That was back when I was a kid.
Wow,
because
that's a smart
he
guy.
ruined his arm, and he didn't have a career because of it, because he threw a curveball too young, and he would not allow anybody to throw a curve before they were 16.
Smart guy. I mean, there's a lot of stress on that elbow and that shoulder for pitchers, and there's only a certain people on this planet that are going to be able to get through all that and make it to the major leagues. And it's a shame if you have to wreck your elbow or shoulder, before you even get to college.
I always tell kids, learn a changeup.
Right. Yeah. That's
before you worry about a curve, learn a changeup.
Yeah. That's can be just as an effective pitch as a curveball.
Yeah. Again, Dr. Erik Stroemer is with us. We have a text here. What is the doctor's opinion on oral glucosamine?
Okay, so glucosamine chondroitin supplements. That's the cartilage supplement that you see on every store you go to that has a vitamin aisle. They'll have this stuff. Some of it's called Move Free, Osteobiflex, Joint MD, I think. There's a lot of different brands. Right now, the science is now in a kind of a gray area. We used to think it was as helpful as taking ibuprofen each day. Then they did some very large studies, and the results came back, well, it didn't help as much as placebo, which is kind of a 50-50 kind of a thing. That being said, I think it's been proven to be safe. It doesn't affect any of your other organs, doesn't have very many side effects. I do have some patients still that really feel like it makes all their arthritic joints feel better. So I don't officially recommend it because our data suggests that we don't know yet. But I tell people it's not harmful, and if you find one that works for you, I wouldn't have a problem having people take it.
You think we'll see the day when cartilage will be able to be going into joints?
Well, I think so. It's just a tricky. Cartilage is very avascular. There's no blood flowing through cartilage, whereas most other structures in your body, even the bones, have blood flowing through them. That's how your body rebuilds things, brings cells to the area. Cartilage grows until you're 18. Then it gets its nutrition a little bit from the bone and then some from the fluid in the joint. So to turn those cells on and make them grow without having any blood flow has been a real tricky process. So hopefully someday that instead of me putting metal and plastic in your knee to give you a new knee, hopefully someday I'll be able to go in there and literally put something that'll get the cartilage to grow back, but we're not there yet.
Can't use cadaver cartilage.
You can use cadaver cartilage about the size of maybe a quarter to a $50. You can transplant that into a part of a knee, but that's usually pretty specific situations where the rest of your knee has to be perfect. I think I have said in the past that if you have a perfect street and one big pothole, we can fix the pothole in your knee. If you have a real bumpy, crummy street and there's little potholes everywhere and cracks everywhere, it's not going to do you any good for me to fill out all those potholes in your knee. So
not all knees are created equal, you're saying?
Correct. Yeah, knees wear out in particular based on genetics from your family, how much you weigh, what you've done your whole life, and if not, you've had some injuries. So those four things pretty much will get you to where, do you have a worn out knee or not?
I went to my uncle's 90th birthday party a couple weekends ago. He's had his knees replaced because he was a mechanic, so he was under a hoist a lot of times on his, on concrete his whole life in his working career. So you could see why his would wear out,
Correct, yeah, and I think that's, I've been in Faribault now for 10 years. We have a lot of, good companies around here, guys working on concrete their whole lives. Definitely people wearing out a little more than I think if you had more of a desk job. I think these people on concrete do wear out sooner.
So is there some thought maybe to changing the flooring in these places? I mean, just...
It's a good question. I think the biggest thing they're worried about at mostly places is safety. They want these floors to be non-slip, et cetera, et cetera. Probably the best thing you can do is have good footwear with good arch supports, good cushion and insoles in your shoes, and try to be the proper weight, keep the weight off. Those would be the best ways probably.
Yeah, well, he's just a little guy too, and always has been, my uncle.
Yeah, I mean, some people, again, it's genetic. It'll wear out no matter what you did.
But it doesn't surprise me when he told me that he had to have both of his knees replaced because he'd been under that hoist for all those years.
Yeah, we're definitely outliving our cartilage. Not to be morbid, but 100 years ago, most of us guys are passing away around age 60.
Yep.
Now, even unhealthy people are living into their 80s. So we are now into an age where we're outliving our cartilage. Our evolution hasn't had a chance to catch up.
And then to exacerbate the problem, he also farmed on the side.
Oh, yeah. That's a hard-working guy.
You know what I'm saying?
I like those farmers, though. They're tough. They are real tough guys. They tolerate the surgeries real well, and they usually don't even come in to see me till it's bone on bone. Those are the guys that don't usually come in until right at the end of their arthritis.
And that hurts.
Yeah, correct.
We're talking bone on bone.
Yep. But again, still, we usually try some bracing and some injections, things like that. See if we can get another year or two on your knee before you even have to have anything done.
You want to put it off as long as possible.
Yeah, within reason. I think if you're 79 and you have bone-on-bone arthritis, not going to help you to wait till you're 82, and the problem then is you could have developed a different health problem. So definitely in your 50s and 60s, I would wait longer. But once you get in your 70s and 80s, and you have bone-on-bone arthritis, then it may, if you're healthy, it may be worth just getting it done.
Well, about 10 years ago, a friend of mine who is a couple years older than me, and he was a dairy farmer, had to have his knees replaced. And so he would have been in his late 40s.
Yeah, I mean, that we don't like to do that, but like a person like that, if they're not able to then work, it's gonna be a huge impact on the patient, his family, and the whole society if that person's not able to work. So if you try everything else and nothing's working, a knee replacement will still function pretty good in a 40 and 50-year-old. It's not perfect. It's not a normal knee, but it's better than what you have. So if you try everything else and you have a bad situation, it's still worth it.
Yeah, I know going younger is frowned upon because the second time is usually not as good as the first, right?
Correct. Every time you have a redo replacement, there's more scar tissue. It's a more difficult operation. Sometimes you have to use different types of parts. So it's usually, the results are not as good. So correct. Ideally, if you could be your only one, you're going to be happier. But again, I talk to people all the time. If they're 52 and it's bone on bone, do they want to, have a good 52 to 75 and then risk having to have it redone, or do you want to tough it out for the next 10 years and then only have one? And it's individual decision.
Yeah, I mean, you're not guaranteed 75, so I think.
Right. Yeah, you never know.
I'd be leaning toward having a little less pain.
Correct. Yeah. Yeah, and none of us really know when we're going to be leaving this world. So again, I like to individualize it based on the person and their situation and their what they want to do. I think it really helps to get to know the person a little bit, know exactly what they want out of their knee, hip, or shoulder. If a guy says, I want to still play golf 200 times a year, maybe we should hold off on giving him a new shoulder and see if we can get other things, working before that. So.
Yep, because you got a follow through there that you have to contend with.
Yeah, exactly.
The swing.
Oh yeah, a lot of stress through the shoulder with a golf swing. Yeah.
A lot of people don't think about that.
No. The shoulder is big. The low back. The shoulder and low back are the two things we see the most that affects people's golf games.
Again, Dr. Erik Stroemer from the Orthopedic and Fracture Clinic is with us. I might be able to sneak in another question if you want to text that at 507-838-5233. 507-838-5233. It's seamless. I get the question. I ask the doctor. How easy is that?
Pretty easy.
Yeah, I think
technology.
Yep. Isn't that amazing?
Well,
of course, you talked about the technology involved since you started practicing, and you're a young guy.
Yeah, I'm only 41, and the technology with computers, computer modeling, the 3D printing thing, that's really helped in orthopedics because we're essentially, human carpenters, human mechanics. Those have been really helpful. Technology for just basic stuff. I came into the office this morning, I had some emails from patients instead of calls, so we're able to electronically talk to people a little bit more, sometimes a little easier, sometimes it's hard to get someone on the phone. So technology's been helpful from the basic stuff all the way to the most serious surgery.
You look at a skeleton, most skeletons look alike, right?
Correct, yeah, we all look the same on the inside.
But the joints, we already established the fact that everybody's knee is different.
Correct, there's different sizes and shapes, yep.
So you have to custom make these knees.
Sometimes we do. Now most of these companies that make the new implants do a lot of cadaver studies and they map it, and so their size is 1 to 15. And so when we are doing a knee, a hip, or a shoulder, part of the process is I'm sizing every part. I'm sizing it up. Is it size 2? Is it size 3? Do we need this? So that's a lot of the art of the surgery, is fitting in the right sizes and things like that.
Yeah. Removing the old joint, the most difficult thing?
No, it's actually gotten very efficient and sophisticated that we're able to, with the computer modeling and the x-ray angles, and we're able to remove that and cut the angles really pretty efficiently now.
Cut.
Yeah, with a, well, you have to reshape the knee bones in a knee. You have to remove the ball and socket in a hip and a shoulder replacement. So use some power tools.
I've got a little less than a minute. Can a complete tear to the rotator cuff still be repaired after waiting 5 to 7 years?
Well, that's a great question. I see a lot of that around here because, again, we have a lot of tough people in this area that decide to tough it out and not come to the doctor, which, you know, I think in most instances is probably the right call. But nonetheless, if a rotator cuff tear is fixable, an MRI is very helpful for us to know if the tendon and muscle is still viable, how much it's retracted, and then how much of the muscle has kind of atrophied. So we can figure that out based on an MRI scan.
So people should probably just give you a call on that.
Correct. Yeah, we'd love to see anyone with shoulder issues. That's what we do.
All right. Hey, thanks. What's your number?
507-334-1601.
That concludes today's edition of AM Minnesota on KDHL AM Faribault, Minnesota.